Mohammed?
Yes. Hi. Thank you, Tom, for introducing me. Shall we go ahead with the oxygen summary?
Please.
Yeah. So next 2 minutes are mine. Thank you. So I'll be taking you through a brief overview of the WHO CED critical topic webinar that we did on oxygen systems, and it was held on May 5th. And so it was moderated by me, and main presenter was Ashnafi Hussain. And from WHO, we had Adriana Velasquez and Laura Ale. So basically what we discussed in the oxygen systems component was how do you basically quantify oxygen demand and identify oxygen sources that are available and select appropriate surge sources to best respond to COVID-19 patient needs, especially in low and middle income countries. That was our focus. So what we initially discussed was that data from China suggests that majority of patients, that is 80% of the patients, will have mild or moderate illnesses, and that only 15% of them will have severe illnesses requiring oxygen therapy, and only 5% will be critically ill and requiring intensive care units. Amongst them, a lot of them would require ventilatory support. So we basically discussed various flow of oxygen which would be required for children, for adults. Within adults, what were the flow rates for non-invasive, for invasive ventilation systems. And the main focus of the agenda around was what were the primary sources of oxygen, and we discussed how oxygen generating plants are very self-sufficient and reliable mode of generating oxygen, and that they were only dependent on power and not dependent on any supplier or supply chain issues that we generally have. Then we discussed liquid oxygen through cryogenic tanks, which is not power dependent, but certainly supply dependent and a bit costly as compared to oxygen generator plants. Then you have, in the smaller units, you have oxygen concentrators and oxygen cylinders. So primarily we have two strategies. One is generate and supply, the oxygen generators and concentrator, or store and supply, that is oxygen cylinders or liquid oxygen cryogenic tanks. We also discussed how oxygen storage and intra-hospital distribution happens. Within oxygen cylinders, you had two strategies to supply. One was near to the patients within the ICUs or within the wards. But then the challenge in the COVID-infested environments is that this oxygen cylinders carries a lot of infection with itself. So what we discussed was that pipeline for intra-hospital distribution network is a very, very important critical element, which uh, uh, in current scenario lacks in a lot of LMICs, but this could be the next focus area if we want to have more sustainable oxygen systems throughout. Uh, we also discussed some of the oxygen needs estimations that we have. Needs estimation were primarily bifurcated amongst the severely ill patient and the critically ill patient. So severely ill patient, which will have raw oxygen therapy at 10 liters per minute, and critically ill patients at 30 liter per minute. However, countries were requested to reassess their needs based on the equipment specific changes, and there are a lot of other parameters around them. So we also discussed the oxygen surge plan. How do you ensure that various sources of oxygen are used at its best? And developing an oxygen surge plan requires you to actually look into what capabilities do you currently have, whether you have spaces for various oxygen generator plants or the liquid oxygen tanks, whether you have power backup or not, whether you have sufficient supplies around it or
30
not.
seconds, Emil.
Yes, concluding it now. And whenever we are planning for a robust oxygen systems, we have to look at the overall oxygen systems and in fact the medical gas pipeline system. So it's always good to look at the air pipeline, the pipeline for nitrous oxide as well. Look for various distribution systems, regulatory regulations and conditioning around it, delivery mechanisms, patient monitoring, pulse oximeters, power supply. All these are very, very critical components. And if in case you do not have pipelines, you're looking at oxygen cylinders alone, please do look at how do you disinfect them so that handlers of these cylinders use it very, very safely. Over to you. Thanks a lot.
Thank you. Of course, there's about 25% of you have responded to the poll and continue to do that. And remember that I mentioned at the beginning, by June 8th, we will write out these full synthesis and summaries of the 6 or 7 topics that I've mentioned in the email a couple of days ago. And to the 6 that we have there, which is availability, maintenance, training, coordination at various levels, we'll add the clinical perspective, of course. So that'll be the 6 that I showed you plus 1 more, 7. So, and in terms of the PowerPoints that the people are presenting right now from, that will be in that synthesis document, in that white paper document that'll come out June 8th. All the kinds of remarks that you're hearing from the chairs of these sessions now will be in that. And once again, you know, the questions and answers, not only from before in those specific topic sessions and in this summary town hall, the Q&A will be posted on the CED website that we sent you to before. Any of the panelists, do you see any questions here on the topic of oxygen that you want to respond to?
So one of the things that we talked about during the webinar on oxygen, as Amil was summarizing so well, is the issue of safety and having oxygen sources of various types, the piped in, the tank, the bottled oxygen, or the manufactured on-site oxygen. It might require some compressors. It might require some oil-based contraption that with oxygen and a heating source can create fires. So we at that time have several questions about the safety and the proper use of such a system of sourcing, distributing, connecting, delivering, and finally monitoring at the patient side. So I just want to highlight that there are specific regulations relating to safe use of oxygen, specifically around prevention of fires. And as you know, there are news reports that some ventilators in use caused fires in hospitals, so we need to be aware of that.
Adriana, I know in the area of oxygen and oxygen concentrators that WHO is led by you with help from Ali and others are planning a send out, a shipment to several LMIC countries. Can you comment on that?
Ale, do you want to comment on the procurement part? Alejandra, you there?
Yep, need to unmute.
Well, many oxygen concentrators are being purchased by WHO to send to the member states, but this is based on the requirements and that member states have submitted to WHO. So we can report on the numbers later because they are now in the process of being purchased and then to be able to be sent.
But that's happening in early June is what I heard last.
Well, the thing is that it takes time because the moment you put the purchase order to the moment that finally the devices can arrive, so it has to be the manufacturing and then the delivery. So it is not immediate, no, absolutely.
But the good news is the process is working.
And the process is ongoing. The process is ongoing. I just want to acknowledge that I did a mistake to all of you. I apologize. We didn't put an option that says none. So if you have nothing to share, nothing as a challenge or so, then the poll does not give that option. So for those that have nothing to share in the third question that says, do you have technical information or procedures? Please just choose the last one, reduce and decontamination, and then we will take it as, or better, we will take it as none, because otherwise we would never know if you had any.
Adriana, we forgive you. We're going to move on to